Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, vitamins for erectile dysfunction. Several vitamins for erectile dysfunction, ED, may help treat symptoms or make them less severe. These include vitamin B9, folic acid, vitamin D, vitamin B3, niacin, vitamin C, and vitamin B12/R/N/R/N. While some research shows that these vitamins might help erectile dysfunction, they typically do not cure or treat the problem as effectively as prescription medications do. In addition, they may not work for a person who does not have a specific deficiency or low level of the vitamin. /R/N/R/N. This article discusses the evidence that vitamins may help when a person has erectile dysfunction and the dietary sources for these essential nutrients. /R/N/R/N. Jessica Olahrnrn Vitamin B9, folic acid deficiency may be an independent risk factor for ED. A folic acid deficiency can impair nitric oxide metabolism. Nitric oxide cues the smooth muscle in the penis to relax, so blood flow is increased to produce an erection. /R/N/R/N. Nitric oxide is produced in the endothelial cell layer covering the smooth muscle. A deficiency in folic acid also contributes to endothelial dysfunction, which leads to erectile dysfunction. /R/N/R/N. In theory, taking a folic acid supplement may lower homocysteine levels. This amino acid inhibits nitric oxide production, and increase nitric oxide, making it more likely to get and maintain an erection. While studies have shown promising results, more research needs to be done to explore the role of folic acid supplementation in ED. /R/N/R/N. Foods rich in B9, folic acid, include /R/N/R/N. In the last decades, several studies have correlated ED risk factors with vitamin D deficiency. /R/N/R/N. Low vitamin D levels might increase your ED risk by promoting endothelial dysfunction. Vitamin D deficiency is also linked to some conditions that are independent risk factors for ED, such as multiple sclerosis, an autoimmune disease that attacks the covering of nerves, depression, type 2 diabetes, heart disease, and cancer. /R/N/R/N. The body creates vitamin D from direct sunlight on the skin when outdoors. Vitamin D levels in the bloodstream vary by season, with levels highest in late spring through early fall and lowest from late fall through early spring. As such, some people do not make enough vitamin D from October to March. /R/N/R/N. Authors of a 2021 review concluded vitamin D blood levels should be measured in people with ED, and vitamin D supplementation potentially represents a low-cost, low-risk method to treat and prevent ED. /R/N/R/N/R/N/R/N. Taking a vitamin D supplement and eating foods rich in vitamin D can help boost your levels. Foods that are high in vitamin D include /R/N/R/N. People with ED can consider having their vitamin D levels assessed. This is done with a blood test. Vitamin D supplementation should be suggested for those with low levels. However, increasing vitamin D intake alone is rarely the solution to ED. In fact, there are some instances where it could cause or worsen your ED. /R/N/R/N. Magnesium, a mineral, is required to convert vitamin D to its active form, 1,25-dihydroxyvitamin D. Vitamin D taken orally needs to go through this conversion, a process that can deplete magnesium stores. /R/N/R/N. If you supplement vitamin D without also taking magnesium, you may develop a magnesium deficiency, which can contribute to ED. /R/N/R/N. Magnesium helps blood vessels to relax. Insufficient amounts mean the penile vein cannot relax, leading to ED. Therefore, vitamin D may indirectly cause ED if not taken properly. /R/N/R/N. This underscores the importance of checking in with a healthcare professional before starting any new medication, including over-the-counter vitamins and supplements. /r/n/r/n atherosclerosis, build-up of plaques in the walls of arteries, reduces blood flow throughout the body, including the penis. Hardened and narrow blood vessels make it difficult for blood to flow into the penis before intercourse. /r/n/r/n statins are drugs that reduce cholesterol levels and can improve ED. However, studies have shown that niacin may be a similarly effective treatment. Vitamin B3, niacin, may help ED because it can improve both cholesterol and lipid levels, which are associated with atherosclerosis. /r/n/r/n A small 2011 study of 160 people with ED found that a daily dose of vitamin B3 improved erectile function in those with high cholesterol. The study found that the 80 subjects who took niacin consistently reported a better ability to get and maintain an erection compared to 80 subjects with mild ED who took a placebo pill. /r/n/r/n A more recent 2023 study found people taking the highest amount of niacin had a decreased risk of ED compared to people taking the lowest amount of niacin. However, the study authors noted it is still not known what the cause and effect link is, and defining the safe threshold of niacin intake to prevent ED requires further research. /r/n/r/n foods rich in B3, niacin, include /r/n/r/n While there is no evidence that vitamin C supplements can improve ED, vitamin C supports the biochemical pathways that ultimately release nitric oxide, which is critical to achieving erections because it increases blood flow. Vitamin C has also been shown to increase testosterone levels and promote blood flow. /r/n/r/n The following foods are rich in vitamin C. /r/n/r/n The role of vitamin B12 and erectile function is not well understood. One study found people with vitamin B12 deficiency were more likely to experience premature ejaculation compared to people without vitamin B12 deficiency. /r/n/r/n However, other studies have found an association between high blood levels of vitamin B12 and erectile dysfunction. Increasing levels of homocysteine are associated with erectile dysfunction. Vitamin B12 plays an important role in the metabolism of homocysteine and therefore, could be a factor in causing erectile dysfunction as well. /r/n/r/n More research is needed to understand the association between ED and vitamin B12. However, adequate intake of vitamin B12 is important for healthy blood, cell function, and nervous system function. /r/n/r/n Foods that are rich in vitamin B12 include /r/n/r/n In addition to specific vitamins, amino acids and other natural remedies may help erectile dysfunction, such as /r/n/r/n Some research shows that vitamins B3, B9, and D might help address erectile dysfunction if the person has a deficiency in these vitamins. They are active in the body to maintain the processes that allow erections, as are vitamin C and other natural remedies. However, they are not the standard treatment for ED. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.